It's Monday. That means it's our employee wellness live stream with the iFix Hearts team and the Ovadia Heart Health Company. And it's my absolute delight. I get to share the microphone today with my colleague Lisa Simmons, nurse practitioner with the Ovadia Heart Health practice. And we're going to get right into it. But we do have one housekeeping item that we need to do before that. And that is to let our listeners, whether you're listening live without the camera or you're able to see us, that this live stream and the recording as well is not intended for personal medical advice. If you're interested in working with Dr. Ovadia and our team at Ovadia Heart Health, please reach out to us at team@ifixhearts.com and we'll get you to the right individual that it will fit your needs. Hey, Lisa, we're not on an airplane together. We're not driving across Oregon together or searching the back highways of Pennsylvania. We're here on the live stream. Great to see you.
You too. Yeah, we have a lot of fun with our trips, but we learn a lot with all those too.
A-
So, yeah.
Absolutely. So I do want to welcome our viewers. If you've got questions for Lisa with her fabulous background, decades as a nurse, also her background as a hormone specialist. Again, this is not personal medical advice, but put your comments in the section. But we're here today to talk about employee wellness. As we just mentioned, Lisa and I travel across the country for the Ovadia team, providing our employee wellness programs. Let me just ask you on a fun note, Lisa, what is one of the things that you enjoy the most about our employee wellness programs?
Getting to see people in real life. That's probably my favorite. Because when you do 100% telemedicine like we do, seeing people in real life and really getting to build relationships with people. So I think that that is a lot of fun for me. I'm definitely a people person. So getting to see people in real life and getting to travel with you, Krishna, it's a lot of fun when we're going cross country. So,
Well, I did both of those, the in person and traveling and, doing our partnership with you. One thing that we emphasize in our programs, and you can help us out with this, we say that we are different, and we truly are. We don't provide disease management programs, but we provide metabolic health focus programs. Can you help, Lisa, some of our listeners who might not even understand what that means or how we're approaching it?
well, when you're thinking about disease management, right, you have to have a diagnosis or a disease. So they're really looking at just managing that. So a lot of that ways is really going to be through medication. And that's more of the management side of it, right? So it's kind of more of a reactive type of treatment. So you get this diagnosis and this is how we treat it. But then for when you really think about metabolic health, it's like looking at what's going on the inside and trying to catch things before they become a disease, or obviously trying to reverse some of these diseases, which a lot of people don't even realize that things can be put into remission or reversed. So when you're looking at metabolic health, it's really looking at what's going on the inside, right? And it's not just one marker that we look at, and it's looking at the whole person, and also including lifestyle, right? Because that plays a key role in just overall health in general and giving the power back to the patient on how they can make changes for themselves and get themselves better, or hopefully, ward off anything, prevent things from happening because they are willing to learn and seek out the knowledge. So,
Lovely description there. And I do want to encourage anyone who's listening to put your comments, questions in the comment section. And as always, if you want to know more about our employee wellness programs, to reach out to us. You can do that in a couple ways. You can reach out online with our /wellness link. here that'll give you also some info about our programs. You can also reach out to me directly. I'm the director of our employee wellness programs at Krisna at ifixhearts.com. So let's talk about that education piece that you brought up. And it's one of the pieces dear to my heart. I've heard you say that. I think we're on the same page in terms of that. How does educating, or kind of give maybe some examples to our audience of how we're helping to educate in the workplace on metabolic health?
I think the biggest thing is looking at people's labs. So I think that that's a big, that's probably the basis that I really do, is being able to look at people's labs and make it for them, right? So everybody's an individual and we treat everybody as such, but educating them, because most people that we do employee wellness with, or even have as patients, they're curious. They want to know more. So when we start educating them, or looking at labs and educating them on ways that they can improve on them. And then when we repeat labs, they see those improvements. So it's really the data that they can see, and then they see, oh, what I'm doing is really working, right? So, and then also too, we have to make it more for each individual person, because you can't cookie cut everything for everybody, because it doesn't work that way. So, and then educating them. Like with you, I really just think knowledge is power. And so I really enjoy that piece, because being a nurse for 30 years, that's what we were taught. We were taught that we educate our patients and we do all the preventions. For all my fellow nurses out there, when you went through nursing school, you had to do the nursing diagnosis. We don't use those things at all, only during school. But really, it was about looking at the patient as in a holistic approach. And I think with metabolic health and prevention, we're looking at holistic approach, right? Through just proper nutrition, through moving our bodies, through exercise. I don't know how many times, Chris and I tell patients, even now when I see them, like, we've got to look at prevention. What's the number one killer of people as they age? It's falls. It's not just about diet and exercise. There's so much more to it. And really looking at longevity and quality of life is, I think, a big part of it as well.
Love it. And falls and movement, right? You threw an arrow right to my heart, as that's my background, exercise physiology, kinesiology. And this is an interesting part also of our work when we go on site to various locations. We're currently working with a manufacturing company in Pennsylvania. We're just finished up with a dental practice in Oregon. And we also do movement, right? We're helping people, as you say, educate them about balance, about strength, about stretch, about resistance training, and providing them with the tools to, encourage them to consider these as part of their movement package for aging, because lifestyle is important. Here's a question for you, Lisa. We get all the time on our live streams is, so nurse practitioner Lisa, how much does my genes matter, and how much does lifestyle matter in being healthy?
Well, considering most things, not a lot of things are genetic. We think they are, right? You've been told that heart disease and diabetes and everything is genetic. It's familial. It's not genetic. There is no gene for it. And understanding that part of it, and what can you do to prevent a lot of things or reverse them. But then when you're thinking about familial, I mean, that's really what it turns into. And there are some genes that make you at risk for certain things. But again, if you are on top of the lifestyle side of it, because that's something that you can really control. You can't change your genes, I'll tell you that, right? But you can control a lot of things, so that hopefully when you're doing lifestyle side of it, because we talk a lot about nutrition, we talk a lot about movement or exercise, but also too, stress and sleep. I think in this world that we live in now, sleep and stress control are so important to overall health and longevity. We think that we control our stress really well, but not as good as we probably should. And sleep does play a key role. I've met a lot of people, sleep when I'm dead, well, sleep, that is your body's time to really rest and repair, and that's for your brain, for your overall body. So important things to look at, just for overall health. So there's a lot of moving parts to it. And I think within our wellness program, it is very different because we are looking at more prevention or reversal of things. And I know, I mean, when I was in mainstream medicine and I worked in a hospital as a nurse, we had wellness programs, and we would go get our blood drawn, and they literally would do my CBC, a CMP, and my A1C, and then my blood pressure and my weight. And then they would go, okay, you're going to get a discount on, your insurance. Well, there should be more of a driver as more of a prevention tool, because the whole goal of employee wellness is to keep their employees well, right? And to keep them so that they are able to work, not so they're calling out sick. So by not looking at things that are preventable or teaching them how to have, improve on the lifestyle so that they are more overall healthy, that's going to be the important part, right? Because that's the whole purpose of an employee wellness, is to keep the employees well. So you have to look at it very, very differently, and you want to really look from the inside out.
Wow. Some great stuff to pull out there. I'm just going to share one anecdote, speaking of sick days, about our most recent client in Oregon while we were doing our 6-month metabolic program. And again, I encourage you to reach out to us if you want to know more about our programs at any of our links that we'll be sharing up here. They didn't have any sick days, right? They were at a different level. And while we can say this is N equals 1 company, anecdotal, but this is what it's all about. And I like to use the word performing well. We oftentimes, especially in workplace wellness, much has been orientated around weight and the scale. And they'll have weight loss challenges, or they'll do a biggest loser in that. But we're looking at real health, metabolic health, which includes all those facets you talked about: the sleep, the stress. I have 3 S's: sleep, stress, and sunshine. We need to stay focused on all 3. And this is what makes, I think, what you shared is, we have to look at each individual, and we have to look at each individual company. Is there any one moment recently from either of our programs on either coast that has stood out to you, Lisa, or an improvement that you were really surprised at by one individual?
I think the biggest thing was having some A1Cs really come down, right? And then just overall, and the other one too, fasting insulin markers. So I think that is huge, too, because again, I was saying, in most, mainstream employee wellness programs are looking at a hemoglobin A1C, which only tells you a measurement of your blood sugar over 90 days, where we do a fasting insulin, which can really show if you're insulin resistant long before your A1C ever flips over into prediabetes. That's huge because damage is being done during that time. And it really is important to educate people to what do they really need to be looking at in their labs that is going to show, am I healthy or not healthy, right? Because you cannot judge a book by its cover. You cannot look at somebody and say, oh, they're thin, they're healthy. That is just not true these days, right? Some people put weight on a little bit differently, and the more weight that you have that you can't see is much more dangerous than the weight you can see. So, getting people to really understand that and being healthy. I think the greatest thing is, having our last N equals 1, not have any sickness during that time is really important, because I know for myself, when I worked in the hospital as a nurse, nurses would come to work sick because you get ostracized for being sick, but we really need to really emphasize wellness so much more, right? And so nurses don't have to come to work sick, and they are not sick at all. That's the goal, right? So,
Yeah, that is the goal. And a couple of real important things. And please reach out if you've got questions, put them in the comments section for us. Or if you want to reach out to us and know more about working with Lisa for a lab review, or with Dr. Ovadia, reach out to ifixhearts.com/talk. Lisa does fantastic lab reviews. And as she mentioned, she's really looking under the hood, not just at your typical standard panel. And on the question, some things that surprised me, I have to say, I think the fasting insulin is the one I've really been, just great enthusiasm for, because in many instances, people had no idea that damage was being done. Right? Insulin, above 20, some up even higher than that. Getting those down to single digits in a short span, like 6 months, it's just been incredible to see. And they actually maybe have more knowledge to go when they go back to their doctor. I think their doctor's going to be surprised at their education level. Is this just as a little bit side? You talked about that even thin people can have damage done. Many people might not even know of what we call the TOFI, thin on the outside, fat on the inside, that there can be actual metabolic damage even when the person is not gaining weight. Can you speak to that just a little bit?
Well, and what it comes down to is, people gain weight differently, right? So you can't always go by what somebody weighs. It's one marker, right? So if you tend to carry more weight around the middle, right, you might be on the thinner side, tall and thin, but a lot of times what people don't realize is visceral fat that you can't see, which is actually around your organs, can be much more dangerous, where, and you can't see that because you're thin on the outside, right? But also too, when you think about, even diabetics in general, because you can be insulin resistant or type 2 diabetes, and you would never know it because everybody kind of assumes that you're diabetic if you're overweight. But I've met many people who are overweight that aren't diabetic. And then I've met a lot of people who are thin who are. So, when you really start to look under the hood and pay attention to what's going on, and before you start seeing things on the pre-diabetes or diabetes realm. But when you're thin, that's why we can't just assume, right? We really do need to take a look under the hood. For the last, since the 1970s and 80s, our food has become so much more convenient. But when you're buying it in a box or a bag, it's not real food, right? And our bodies don't really know what to do with it. And it's full of sugar and salt. And the sugar is just so bad for you. So, when you talk about TOFI, it's hard to say, just because you just really need to get real labs done so we can see what's going on underneath there, because you can't tell. You cannot tell when you look at somebody if they're healthy or not. So
great points there. And as we mentioned, not only in our private practice with the Ovadia Heart Health team, but also in our employee wellness programs, we are doing these extensive testing to see where you are, because that's going to tell us the most, as well as doing the educational component on metabolic health. And you've been a nurse practitioner for a long time. What do you see as some of the biggest changes? Let's just talk even over the last 10 years for you in your practice.
I think the biggest thing that I've seen in my 30 years, when I was still a new nurse, a baby nurse at the bedside, I think the one thing that I look back on now is I would have elderly patients, but they would only be on 2 or 3 medications. That was it, right? That's all they were. By the time I left the bedside, I had people in their 30s on 30 plus medications. It was a big change, right? And even when I started nursing, there wasn't a lot of very heavy people. By the time I left the bedside, when you have to have 6 nurses turn a 700-pounder, that then your eyes really open up, because it's like, how did we get here? Because this was never seen before. And, it's heartbreaking, but I think we really need to, really pull back the onion, figure out what, just get down to the root on what is the cause to all of this. And I think the biggest thing is just the increase in medications. And again, it's more of the disease management. You get a diagnosis and we treat. You go to the doctor because you don't feel good with this. Now, all of a sudden you have another diagnosis and you get another medication. And that's how we end up on 30 medications, which in turn probably interact with each other in some way, shape, or form, which aren't going to make you feel better. what you need to do is you look at your doctor and you go, what's causing this? How did I get here? What do I need to look at? What do I need to be doing? You have to take some responsibility and really pull it back and say, okay, what can I do? Right? Because there is no pill or potion that can fix everything. So you have to really look at your overall lifestyle. And it is just kind of breaking it down. I call them the 4 pillars of health. You look at nutrition, you look at exercise, you look at stress, you look at sleep. Where are areas that I can improve? Right? What can I do? Because you're the only one who's in charge of your overall health. And, we're here to teach. And I think that's why Krisna and we're like a tag team. We love this. We're very passionate about getting out and educating people, because really knowledge is power, and really educating employees on how they can be healthier. So, and it's for overall health. It's not just so that you can go to work every day, right? We're not doing that just so we want you to live a long, productive life is super important. But again, you want to be healthy every single day. When you get up every day and nothing hurts and you're happy and you feel good, that's a great day. And I want everybody to have a great day.
Oh, I love that. And I'm going to second that. There is no magic pill. Hate to say that to our audience here. Hate to disappoint you in hoping you were going to hear there's a magic pill, there's a magic solution, there's a magic supplement. We're here to give a dose of reality, but there is a whole lot you can do. You talked about the 4 pillars that we emphasize: nutrition, exercise, sleep, stress. There's also one thing kind of gluing it all together. We talk about this frequently when we're on our trips, is why do you want to be healthy? And understanding and tapping into that on a company level is important. Uh, why do you want your employees to be healthy? But very much on the individual level. Any thoughts on the why, Lisa?
Well, I think my big thing is I always say your why should make you cry. It should be really important enough to you to want to make changes. So I'm a grandma of 4, right? And I want to be able to take care of myself as and be able to go do fun things with my grandkids and really enjoy them. I think they keep you young as long as I can stay young. So the more when you feel really good and you're happy and things are going well, you definitely, it's a good thing. And I also never wanted my children to take care of me, right? And you start to see that. I think on our travels, we've talked about it in general. We go to airports all the time. We're traveling for employee wellness, and we see so many more wheelchairs and people that cannot function, and they're not that old, right? Because again, I think the big saying as well is if you don't use it, you lose it, right? And so we all have a responsibility to our own selves to make sure that we're healthy, and really take that power back, and and ask why. It's why do I want to do this? Why do I want to make the changes? But why in general? Exactly.
Yes.
Just looking at the whole big picture. So.
And this is important concept. If you're an HR director or you're running a company, you might think, well, we already have a wellness program. Why do we need something else? Well, we are something else very different, because if you've had a wellness program and you're not getting any results, people aren't getting any healthier, you're not moving the needle, that's a poor business investment. I mean, I've got an MBA, a master's in business, and I would just say that's a bad business investment. And maybe it's time to make a different investment. And if you want to know more about our programs, reach out to us, schedule a call. You can email me directly or go to wellness on the site. Something I also want to, there's my email, Krisna at iFixHearts, is it's kind of a known factor, or at least I've been doing worksite wellness since the 1980s. Ooh, back in the dark ages for some folks, but probably listening in weren't even born. Is that it was sort of this idea that leadership and management made a wellness program, they put it on paper, and then they got a few people to try to make it happen, but they didn't do it themselves. So they didn't participate. As a company, what about our walk the walk kind of, let's say, mantra? What would you say about that, Lisa?
Oh, I think so. Because as a company, when you see us, we're all passionate about what we do, but we do what we teach as well. But even in the companies that we have done for employee wellness, it's been the higher ups that have done this and they realize this is so beneficial, right? And they're doing it along with the employees, which I think, goes to show them that, this is really important to them. They're doing it too, right? So, but it does. And also, too, I think what we've seen is really the camaraderie and the accountability and the learning from each other that they do. Oh, what are you doing? This is working for you, right? And even with all the knowledge, again, we can say the same thing to a group of people and people are going to hear it very differently. So sometimes just having the other coworkers that are doing the same thing and being able to cheer each other on, or coming up, hey, you know what, I just made this recipe the other day and it was so good, you guys need to try it, right? So it just keeps everybody on the same page, but also to that accountability and kind of like your own cheering section, like we can all do this together, right? Because it's always a team, right? Anytime you look at it, and our team's the same. We do that. Like if you guys knew, we post our food sometimes, or we post the things that we do, like exercise things that we do, and we have a walk thing. I don't know how I started this, but we did. We if I go walking, like we have, or on Strava, so now it puts it into our Slack, and we can all kind of keep each other accountable on movement. So we do the same things that we teach within our company as well.
And
So
this is
important.
so important. And a couple things that we've been on site for some of our programs, and yes, we have the CEO doing the movement along with everybody else from ages 20 to 78 in that particular company, and the peer-to-peer camaraderie, as you say, and sharing just takes it to a whole other level, right? We also had one company that they made their own Facebook group for recipes. So they're sharing recipes online with each other. This is also an important part of the process. Is there anything, what you see that in employee wellness programs where companies could do better?
I think they could. I think if there was different incentives other than lower pay, or lower amount on the insurance, if it was overall real true health where it wasn't, or if they meet certain markers other than just weight and things and your blood pressure and things like that, the things that yes, they matter, but in the scheme of things, are they really going to give you longevity and quality of life? So because again, weight is just one predictor. And so when you're looking at more of, hey, your fasting insulin's below 10, okay, well, that means that you're going to, you'll get a discount on your insurance, or things that are measurable that make a difference for the long run. Because if your fasting insulin's below 10, we're looking at preventing diabetes, which is going to prevent other things, right? So looking at that, or blood pressure does play a key role, right? But you know what, instead of just looking at your blood pressure, let's look at your inflammatory markers. Where are your inflammatory markers, and what is the driver of blood pressure, right? So really starting to look at those, and then all of your markers look really good, now you get a discount on your insurance.
Great ideas, right? And why not use some creativity? So let's say you allow the individuals to choose a marker they want to improve on, whether it's lowering their triglycerides, or as you suggested, lowering their fasting insulin, or maybe someone had a goal to reduce the medications, to work with their medical provider and work with their educational consultants to help them be able to do that. And especially, as you mentioned, there's so many people on multiple medications. There's lots of room for creativity. And what's one thing that you've maybe just learned yourself about yourself this year in doing employee wellness programs?
I needed to move more. I'm going to tell you. So, it's funny because I've eaten this way for a long time, still on my journey as well. But I was like, what is different? What did I do different 6 years ago that I'm not doing now? I work from home. I became much more sedentary. So I had to be intentional. I think being intentional is really important, and prioritizing myself, prioritizing my movement, and really being true to me. And that is a big deal, because sometimes you just have to look in the mirror and go, what am I doing that's not working, right? And mine was movement. And I feel better. I was having a lot of hip pain, and they told me it was my back. I started walking every single day. I have no more back pain, no more hip pain. So it's amazing what getting healthy and looking at your lifestyle can do for you. You just feel better overall, and it's so important.
And
Go ahead.
this is, oh, sorry, this is a great, I just immediately thought of, there's a saying in dance, and I have a long background as a professional dancer, that the true way to learn something is teach it to someone else. And through our programs, we're teaching, we're educating, and we got to learn something ourselves. I see my biggest takeaway is I needed to get more sunshine. And I talked about that numerously, and made a real concerted effort this last year to get some daily minutes in the sun. Granted, I have a little bit of leeway here because I'm in Arizona. That said, sometimes we can just get too busy with our work, and we think about helping everybody else and not ourselves.
And actually, speaking on getting more sunshine this time of year, Kristen, as well, we're going into seasonal affective disorder time of year, right? So making it, and it's important to get out there and really make sorry. To get out there and make people, realize that how important it is to get the sunshine and the exercise and stuff too. Because I know a lot of people who actually do get seasonal affective disorder. I'm like that too. I will say I'm solar powered, because I can feel my mood improve just by being out in the sun. Like it's amazing. So, I think it is so important, but you have to be intentional. Get out there when it is sunny. It's not going to be sunny all the time, but getting out there is really, really important.
And we know that from the research, even a few minutes, there's a lot of work on mitochondrial enhancement, cellular function, by, even if you don't have a lot of direct sunlight. Some people are using, light therapies, various kinds, red light or other bright light therapies, if you don't have access to the sun. But again, these are the kind of key unique components of our program, that we're not just looking at your weight, and we're not just looking at your total cholesterol. We're really looking at everything that's going to enhance your performance, not only at work, but in life. Once again, I want to put up the links if you'd like to talk to someone about our medical practice, either to work with Lisa Simmons herself, or with Dr. Ovadia, or both. If you want to know more, that's the link right there, ifixhearts.com/talk. If you'd like to know more about our wellness programs, it is ovadiahearthealth.com/wellness. You can also email me directly at Krisna@ifixhearts.com. So as we get close to the end here, Lisa, what's something maybe I've forgotten, or that you wanted to highlight about our work in the medical practice, or specifically in our employee wellness programs?
Let's see. I'm trying to think if we really missed anything. I think we touched on the majority of really what we do in general. I just urge people to really take a look at this. And if it's, I know a lot of times we have a lot of people on here that follow Dr. Ovadia all the time, but you've really been, not sure, and not even just employee wellness, but wellness for yourself, looking to see what's going on. Ask the questions, be curious. If you want to get your labs looked at, that, I mean, I'm going to tell you, it's my favorite thing to do all the time because it's a great educational piece. And I want people to walk away with the knowledge to be able to read their labs and know exactly why we do the labs that we do, right? And how can you improve upon them? And it is very individualized. And the other thing is when you work with us, you get awesome health coaches like Krisna herself. They're the backbone to our company. Health coaches are so needed because they have a wealth of knowledge, and they really do help our patients to troubleshoot, to figure out the things that they need to be working on. Again, it's so individualized. And I mean, we couldn't run this company. I mean, it's Dr. Ovadia and myself, but we could not run this company and what we do without our wonderful health coaches, because they are the backbone. But again, when you're looking at overall health, be curious. If something doesn't seem right and you're not getting the answers that you want, come see us. Let us take a look. Let us break it down. We really do look at the whole big picture on what you're currently doing in your lifestyle, what you've done in the past, because again, you can't always run from your past, right? But really helping you to get healthy. And I think that is really the key. I think Chris and I have really touched pretty much on everything that we do within this company when it comes to the employee wellness. But overall, we just really want to educate and get people healthy, just one person at a time.
One person at a time, one meal at a time, one company at a time. And I think this is the time of year. Also, if your company has had an employee wellness program and kind of lackluster, hasn't really gotten results, just start talking about what you would like to see. Find other colleagues, talk to maybe your HR department about, hey, what if we had some education on metabolic health? Because it's really about that conversation and starting the fire amongst us. Stay connected with us. We have lots of interesting guests coming up this week. I'll just do a little plug. We're going to have Jane Buxton, the author of The Plant-Based Con. We'll be doing a live stream with her on Thursday. Excited about that. And as Lisa says, we're a team. We work as a team with the Ovadia Heart Health. We have fantastic experienced certified coaches. We have experienced nurse practitioner, Lisa, with decades of experience here. Of course, we have a heart surgeon, Dr. Ovadia. And because as staying healthy requires a team and requires a coach, we can't do it by ourselves. So reach out to us. Thank you for listening, and hope that you've gained a couple little pieces to think about for your own health and the health of your company. If you want to know more about our programs, the link is ovadiahearthealth.com/wellness, or just send me directly an email, Krisna@ifixhearts.com. And if you want to schedule an appointment with Lisa or with Dr. Ovadia, reach out to ifixhearts.com/talk. And well, I'm honored I get to work with you. I'm honored I get to travel with you. And where are we going next?
We're going to Pennsylvania.
Well, actually, we've got one in between there.
Yes, we do. We do.
We'll both be at Hack Your Health Conference in Tampa, Florida in November. So come see us at the booth, hang out with us a little bit, maybe even have a coffee with us. And thanks for joining our Ovadia Heart Health live stream.